Okay, so welcome to the deep dive, you guys. We're going to be diving into a pretty heavy topic today,
Yeah,
but one that we get asked about a lot, and that's psychopathy.
right.
We have this incredible document
Yeah.
from Dr. Russ Curtis. It's
Mm-hmm.
called Psychopathy 640.pdf,
Okay.
and it's really thorough.
Yeah, it really gets into all of the nitty-gritty.
Yeah.
Um,
We're going to try to unpack that for you guys today.
yeah, it's really important to understand this, and I think one of the things that we want to make sure to address right off the bat is that psychopathy isn't about,
Right.
evil or
Right.
possessed people or anything like that.
Right.
Dr. Curtis makes it clear that it's a neurological and genetic disorder.
Right. Yeah, and I think that this document is really interesting because it gets into all different aspects of this, the potential roots of it,
Yeah.
How it can show up in different areas of life and
Sure.
even in the corporate world,
That's right.
and then how it's assessed.
Yes.
And the potential for treatment.
Absolutely.
So we're going to try to extract the key insights for you guys today.
Yeah, this is going to be a good one.
So let's just jump right into it.
Huh.
I think that maybe a good place to start is talking about antisocial personality disorder, or ASPD,
Okay.
and how it relates to psychopathy.
Yeah, so ASPD is a broader category, and I guess the main feature of that is that it's a consistent pattern of disregarding other people's rights.
Okay.
So about 3% of adults meet the criteria for ASPD, but in incarcerated populations, that number jumps to about 60%.
Wow.
And then when you look at psychopathy, it's more specific.
Okay.
It's estimated to be about 1% of adults in the general population, but a much higher 20% of prisoners.
Wow.
And over 50% of violent crimes.
Wow, that's huge.
Yeah. So not everybody with ASPD would be considered a psychopath.
Got it. Okay.
Psychopathy is more of a subset, I guess you could say.
Okay, that's a really important distinction
Yeah.
for our listeners.
Yeah.
Okay. So there's this concept of the McDonald Triad.
Yeah.
What is that?
So the McDonald Triad, it's bedwetting, fire setting, and animal cruelty.
Okay.
And for a long time, there was this idea that that would predict antisocial behavior or even psychopathy later in life.
Yeah.
But Dr. Curtis points out that current research shows that this isn't really reliable as a predictor for psychopathy,
Okay.
specifically.
Yeah.
It might point to some problems, but maybe not specifically that.
Okay.
What researchers are kind of understanding now is that it's more indicative of like a dysfunctional home environment
Got it.
and maybe some poor coping skills in a child.
Okay.
Yeah.
So while those are red flags,
Yes.
they don't necessarily point directly to psychopathy.
Right. They're just something to be aware of.
Right, exactly. Yeah, okay. So what about neurologically?
Right.
What are researchers kind of looking at in terms
Yeah.
of the brain?
Yeah. So some interesting stuff there. Research has shown that there might be some differences in brain areas that are responsible for processing emotional memories and social inhibitions.
Oh, okay.
So think of it as like a wiring difference
Mm-hmm.
that makes processing emotional cues less salient
Got it.
or impactful.
Yeah.
And so, that plays a big role in the lack of empathy that we see.
Okay.
And then there's also this concept that they might imagine things differently, which could affect their ability to put themselves in other people's shoes.
Interesting.
And also their ability to control their impulses
Right.
and make wise decisions.
It's like their emotional intelligence
Yeah, like emotional intelligence.
is potentially different.
Yeah.
Okay.
And some researchers even use the terms empath versus psychopath to kind of highlight that difference.
Right. Like their whole operating system is just
Yeah.
different when it comes to
Yeah.
that kind of information. Okay. So the document also talks about James Fallon. Who is he and why is he important?
So James Fallon is a neuroscientist,
Mhm.
and he made a pretty amazing discovery when he was looking at some of his own brain scans.
Okay.
They showed the patterns that you often see in people who have psychopathy.
Oh, wow.
And so he identifies as having some psychopathic traits himself.
Okay.
But he was raised in a really supportive upper middle class environment.
Okay.
So
Yeah.
he had lots of positive influences.
Right.
And so his perspective kind of brings up that whole nature versus nurture debate.
Right.
And it suggests that, maybe you can have the predisposition,
Right.
but if you have a positive upbringing, it might influence how those traits actually manifest.
So fascinating.
Yeah.
Okay. So Callous unemotional traits, or CU traits.
Right.
The document talks a lot about these. Why
Yeah.
are those so important?
So CU traits are actually considered by many to be the strongest predictor that we have right now for adult psychopathy.
Oh, wow. Okay.
And these are formally recognized in the DSM-5,
Mm-hmm.
which is the diagnostic manual.
Right.
And as a limited pro-social behavior specifier for conduct disorder in children.
Okay.
So the core features that you would see
Mhm.
are a lack of warmth and caring about other people,
Okay.
a noticeable impairment in empathy,
Okay.
and just a generally unemotional presentation,
Right.
often with low expressions of fear or anxiety.
Okay, so it sounds like there's just like a fundamental
Yeah.
lack of emotional connection and resonance
Absolutely.
with others.
That's exactly it.
Okay.
Um, and research shows that there's a couple different things that can contribute to these traits.
Okay.
Definitely a genetic component.
Okay.
Harsh parenting has also been linked to the development of these traits.
Interesting.
But, and this is really important, a parenting style that's warm and focused on rewarding positive behavior
Mm-hmm.
has actually been shown to reduce these traits.
Wow, that's really
Yeah.
important for people to understand.
Yeah, it's not a
Yeah.
foregone conclusion.
Exactly. Yeah. Okay, so
So kids who show high levels of CU traits, they tend to engage in what's called proactive or instrumental aggression.
okay.
So that's aggression that's planned and goal-oriented.
Okay.
And without intervention, they often follow a more severe and persistent pattern of antisocial behavior.
Oh, wow.
Yeah. And it's also worth noting that these traits are seen more frequently in boys.
Okay, so that's really interesting about the parenting styles.
Yeah.
That's a huge takeaway for me.
Right.
Is that, it's not just this like, oh, well, this kid's, doomed
Right.
to
He can actually
be this way. You can actually intervene.
intervene and make a difference.
Wow. Okay, so besides CU traits, what are some other early warning signs?
Okay, so you often see frequent and persistent conduct problems,
Okay.
early diagnosis of ODD or oppositional defiant disorder.
Mm-hmm. And conduct disorder that starts in childhood rather than adolescence?
Okay. You might also see things like high levels of hyperactivity and impulsivity,
Mm-hmm.
elevated narcissistic traits, and generally high levels of emotional difficulties in childhood.
Okay.
Also, a negative and unstable home environment in early childhood can be a concern.
Yeah.
Exposure to bullying, a noticeable lack of fearfulness,
Okay.
and then certain patterns of parental behavior such as rejection, excessive punishment, or strict control can also be a concern.
So it sounds like a really complex interplay of
Is
biological predispositions and environmental factors?
Yes, absolutely.
Okay. So the document makes a clear distinction between psychopathy and psychosis.
Yes.
Can you unpack that for us a little bit?
Yeah, so psychosis refers to a condition where there are disruptions in a person's perception of reality.
Okay.
And this can include things like hallucinations,
Mm-hmm.
like hearing voices,
Okay.
which is common in schizophrenia.
Okay.
Psychopathy is a distinct set of personality and behavioral characteristics.
Got it.
So one involves a break from reality in terms of perception, and the other is about a specific pattern of personality and behavior.
Okay, so it's how they perceive reality
Right.
versus enduring patterns of
Yes.
personality and behavior.
That's a great way to put it.
Okay. So the dark triad,
Yeah.
what is that? And how does psychopathy fit in there?
So the dark triad is a term used to describe a cluster of 3 personality traits.
Okay.
Narcissism,
Okay.
psychopathy,
Mm-hmm.
and Machiavellianism.
Okay.
Narcissism involves a sense of superiority and entitlement.
Right.
Psychopathy we already talked about.
Right.
Machiavellianism is characterized by a manipulative and cynical view of others.
Okay.
They often use deception to get ahead.
So like they're kind of using people.
Yeah, they see people as pawns in their game.
Right.
So these are separate traits, but they can overlap
Got it.
and sometimes appear together.
And so it seems like that's not a great combination.
No, not
If you encounter somebody with that,
right.
you're probably not going to have a good time.
Right. They might leave a trail of destruction in their wake.
Okay. So the document talks about the corporate psychopath.
Yes.
I think that this is something that a lot of people have kind of heard of.
Right.
What is that?
So, in the business world, we use a lot of aggressive metaphors.
Hmm.
Things like killing the competition or ruthless efficiency.
Yeah.
And some researchers suggest that that kind of language might resonate with people who have psychopathic traits.
Okay.
And so it even gives some examples
Yeah.
of companies and leaders that have been discussed in this context.
Like what?
The early days of Bitcoin, the Theranos scandal, the CEOs of WeWork and UBR,
Yeah.
the Fire Festival debacle.
Wow. Right.
Even companies like Apple and Sunbeam at different times.
So it runs the gamut.
Yeah, it really does.
Okay.
And research by Dr. Keel supports this idea that psychopathy isn't limited to any particular socioeconomic group.
Yeah, that's really important for people to understand.
Yeah.
It's not just like...
It's not just criminals. It's not just people who are, in prison.
Right.
Or whatever it be.
Anyone.
Anybody.
Right.
Anywhere.
Wow. Okay. One statement that stood out to me in the document was that no child says, I want to be a psychopath.
Yeah, that's a good one. I think that's really important because it highlights that this isn't a choice or a desire to be bad or anything. Right. How they're wired.
They're wired. Yeah.
And then also some well-controlled research, specifically by Dr. Marsh, indicates that proactive aggression, which we talked about a little bit ago, is generally not a result of child abuse.
Okay.
Reactive aggression, which is more impulsive and emotionally driven, is more likely to be linked to experiences of child abuse.
Okay, that's a really important distinction.
Yes.
Okay, the document also talks about the amygdala.
Yes.
And how that can potentially be related. Can you explain that?
Yeah, so the amygdala is the part of the brain that's heavily involved in processing emotions, particularly fear. And research suggests that damage to the amygdala, especially when it happens in childhood, can be a contributing factor to the development of psychopathy.
Okay.
And the document gives the example of Urbach-Wiethe syndrome, which is a rare genetic disorder that can lead to the calcification and damage of the amygdala.
Wow.
And people with this condition often show difficulties in processing fear and recognizing fearful expressions in other people.
Okay.
So that adds further evidence to the idea that there's a neurological basis for this.
So that's really interesting, kind of getting into the why of all of this.
Right.
Okay, so let's talk about assessment.
Okay.
The Hare Psychopathy Checklist Revised, or the PCLR.
Right.
This seems to be a really important tool.
It is the gold standard for assessing psychopathy in adults. But it's important to remember that it should only be used by professionals who have received specific training.
Okay.
It's not something that you just give to somebody.
Right.
And it involves a semi-structured interview with the individual and a review of their file information.
Okay.
And each item on the checklist is rated on a 3-point scale. 0 if it doesn't apply, 1 if it applies somewhat, and 2 if it clearly applies.
Got it.
And then the total scores can range from 0 to 40.
Okay.
And a score of 30 or higher is often used as an indicator of a high level of psychopathic traits.
Wow. So this is like a really in-depth thing.
Yeah, it's very comprehensive.
Yeah.
Not just a quiz.
Right, exactly. Yeah, okay. And the items on the PCLR are grouped into 4 areas.
That's right.
Right.
So the interpersonal factor, which includes traits like being superficially charming and manipulative.
Okay.
The affective factor, which is a lack of remorse or guilt, and shallow emotional responses.
Okay.
The lifestyle factor, which is impulsivity and a need for constant stimulation.
Got it.
And then the antisocial factor, which covers poor behavioral controls and a history of antisocial behavior.
Okay, so it's really comprehensive, looking at all these different aspects.
Yeah, it tries to get a full picture of the person.
So what about assessing younger individuals?
Yeah, so since the PCLR is really designed for adults, there's some other tools that have been specifically developed for assessing psychopathic traits in younger people.
Okay, like what?
There's the Psychopathy Checklist, Youth Version, or PCLYV.
Okay.
The Antisocial Process Screening Device, or APSD, which is actually the most widely used tool for identifying callous and unemotional traits in kids.
Okay.
The Child Psychopathy Scale, or CPS, which is typically completed by parents of children age 12 and older.
Okay.
The Youth Psychopathy Traits Inventory, or YPI, which is a self-report measure for kids 12 and up. And then the Youth Psychopathic Traits Inventory Child Version, or YPI-CV, which is another parent report measure.
Wow. Okay, so there's a whole bunch of different tools out there to assess.
Yeah. Kids are different from adults.
Right.
So you need
different tools.
Tools, right?
Yeah.
Okay. And the document gives some examples of questions from the Child Psychopathy Scale.
It does.
Can you share a few of those?
Yeah. So One question is, does he stay away from scary things and places?
Okay.
Um, Another question is, does he try to act charming in order to get his way?
Okay.
Does he give, lend, and share things?
Mm-hmm.
Does he usually feel guilty after doing something wrong?
Okay.
Does he regret many things that he has done?
Got it.
Is he shy?
Okay.
And when he gets in trouble, is he a smooth talker?
Wow. Okay. So they're really trying to get at, like,
Yeah, they're trying to see if,
the nuance of.
yeah, if those underlying characteristics are there.
Yeah. Okay. What about if there's a concern about immediate violence?
Right. Are there specific tools or approaches for assessing that?
Yeah. So when that's the priority,
Mm-hmm.
professionals often use tools like STAMP, which stands for staring and eye contact,
Okay.
tone and volume of voice anxiety, mumbling and pacing.
So like observable behaviors.
Yeah, things that you can see right then and there.
Right. Okay.
And they often use that in combination with the Brozett violence check,
Okay.
which is another short assessment that focuses on current behavior.
Okay. So really focusing on the here and now.
Yes, exactly.
Okay. The document also mentions the VRISC-10 and the BASC-3. What
Right.
are those?
Okay, so the VRISC-10 is another tool that's used to assess the risk of violence.
Okay.
And the BASC-3, which stands for Behavior Assessment System for Children,
Okay.
is a broader approach to understanding a child's behavior and emotional functioning.
Okay.
And what's really valuable about the BAC3 is that it gets input from multiple perspectives.
Okay.
So they call that triangulation of data.
Got it.
So they get input from parents, from teachers, and from the child themselves.
Okay.
And the results are given as T-scores.
Okay.
An average score is around 50.
Okay.
And schools that are significantly higher or lower than that are generally considered clinically significant.
So like above 60 or below 40.
Yeah.
Okay.
And it assesses a wide range of areas like aggression, anxiety, attention problems, atypicality, conduct problems, depression, hyperactivity learning problems, somatization, and withdrawal.
So really thorough.
Yeah, it tries to get a complete picture of the child.
Okay. Are there specific scales within the BASC-3
Yes.
that are particularly relevant to psychopathy?
Yeah, so the attention problem scale can be important because it kind of overlaps with some of those impulsivity aspects.
Right.
The atypicality scale includes items that relate to unusual or odd behaviors.
Okay.
And then the withdrawal scale looks at tendencies to isolate oneself and avoid social interaction.
Okay.
And actually, items from both the atypicality and withdrawal scales are combined to create what's called the developmental social disorder composite, which is often used to screen for autism spectrum disorder.
Oh, wow. So there's some overlap there.
Yeah, there can be some overlap in how things present.
Okay. So the document also talks about observable facial expressions and body language.
Yes.
That are associated with psychopathy.
Yeah.
This is really interesting.
It is. So one thing that researchers have noticed is what they call the rigid Duchenne smile.
Okay.
And that's a smile that doesn't really reach the eyes.
Right.
Like a genuine smile would.
Right.
And then there's also something called the psychopathic stare.
Okay.
Which is characterized by the head remaining still and a gaze that kind of lingers.
Wow. So it's like intense eye contact?
Yeah.
Okay.
And then some studies have also shown a lack of typical pupil dilation in response to things that would normally induce fear.
Interesting.
So like a physiological response that you can't really control.
Right.
Suggests that they're not experiencing fear in the same way.
Yeah. Okay. What about body language more broadly?
Okay, so some patterns that have been observed include an increased use of hand gestures,
Okay.
which could be a way of trying to appear dominant or to distract from deception.
Got it.
There's also something called beat hand gestures,
Okay.
which are those rhythmic up and down or back and forth movements of the hands.
Yeah.
And then an increase in self-manipulatory behaviors like touching their face or fiddling with jewelry
Okay.
can also be a sign of discomfort
Got it.
or an attempt to distract.
Okay.
And then lastly, some researchers have noted instances of individuals invading personal space,
Oh, wow. Okay.
which could signal a sense of arrogance or a lower level of social anxiety.
So it's really fascinating.
It is.
How much you can kind of pick up from these nonverbals.
Yeah.
Okay. And then lastly, verbal behavior patterns.
Right.
Are there certain things that might stand out there?
Yes. So they might try to steer the conversation away from their past.
Okay.
They might say things like, that was the past, I've moved on.
Right.
They might use a lot of justifications
Okay.
that involve because censor so that.
Okay.
They might use a lot of flattery.
Okay.
And interestingly, studies have shown that they tend to use fewer words related to anxiety or worry,
Okay.
but more frequent use of personal pronouns like I and me.
Interesting. Okay.
They might also get frustrated when asked to talk about their emotions in depth.
Right.
And then finally, you might see a disconnect between their verbal and nonverbal cues.
Right.
Their words might sound sincere, but their facial expressions or body language might tell a different story.
Right. So they're not congruent.
Exactly.
Yeah. Okay. So we've really gone in depth here
We have.
on all these different aspects of how this can manifest.
Yeah, we've covered a lot of ground.
Let's talk about treatment.
Okay.
The document kind of starts by addressing some common misunderstandings
Right.
about treatment.
Right. So, one misunderstanding is that psychopathy is untreatable. Another one is that treatment could actually make them worse.
Right.
And it is true that the general public often believes that it's untreatable.
Right.
And unfortunately, high scores on the PCLR can influence legal decisions.
Wow.
But the prevailing view among professionals is that treatment can be beneficial.
That's good to hear.
Yeah.
Okay.
So there is hope.
Yeah.
Yeah.
And the document briefly mentions the importance of self-care for counselors working in this field.
Yes.
Why is that so important?
Well, working with individuals who exhibit psychopathic traits can be really demanding.
Right.
And so counselors need to be proactive about their own well-being
Got it.
to prevent burnout.
Okay. So it's a tough.
It is.
Okay, so the document really emphasizes prevention and early treatment.
Yeah.
Why is intervening early so important?
So the main reason is that personality traits become more established and less flexible as a child gets older.
Okay.
So identifying potential issues early offers the best chance of influencing those developmental trajectories. The document highlights strategies like parent management training, which teaches parents effective ways to manage behavior.
Okay.
Reciprocal eye contact training.
Okay.
And promoting household stability.
So really important stuff.
Yeah, laying the foundation for healthy development.
Okay. And the document includes some really powerful insights from people who self-identify as having psychopathic traits.
Yeah.
Can you share some of those?
Yeah, so one individual shared, I had no sense of self.
Right.
And another one said, talking about engaging more with emotions through therapy. I have more complex emotions. Now it's hard to have emotions. It's great, but it's also hard.
So they're almost like rediscovering what it means to be human.
Yeah.
Wow.
It's fascinating.
Yeah. So the document discusses affect regulation as a really important target in treatment.
Right.
What is that?
So affect regulation refers to the ability to recognize, experience, and express emotions in a healthy and appropriate way. And for people with psychopathic traits, this can be really difficult.
Right.
So treatment approaches might utilize tools like the emotion wheel, which helps people identify and label their emotions.
Got it.
Or a feelings thermometer,
Okay.
which helps them understand the intensity of different emotions.
Okay, so they're kind of learning.
Yeah, they're learning about their own emotions.
Yeah.
Which is something that they struggle with.
Right. Okay. And the document highlights regulation-focused psychotherapy for children, or RFPC.
Yes.
What is that?
So RFPC was developed to help children who have conduct disorders.
Okay.
And the idea is that a lot of the acting out behaviors that we see come from an underlying difficulty in expressing emotions.
Got it.
So a key part of RFPC is non-directive play therapy.
Okay.
Which starts after a thorough history of the child has been taken.
Got it.
And the therapist observes and tracks the child's play.
Okay.
And reflects back their actions and choices. And they talk about the end of therapy fairly early in the process.
Oh, okay.
And then a really important aspect is giving words to feelings.
Okay.
So the therapist helps the child to identify and label their emotions.
So they can start to understand what's going on.
Right. They're making connections between their behavior and their feelings.
Okay. And finally, the document briefly mentions the Mendota Juvenile Treatment Center.
Yes.
What's their approach?
So they use a highly structured therapeutic environment.
Okay.
With a decreased focus on punishment.
Okay.
And a big emphasis on rewards.
Okay.
To encourage pro-social behavior and self-regulation skills.
So it's kind of like a reward system.
Yeah.
Got it.
They use something called the today-tomorrow system.
Okay.
But the document doesn't give a lot of details about how that works.
Okay.
But the overall approach suggests a focus on building positive behaviors.
Right. So really trying to find what works for
Yeah,
these kids.
absolutely.
Well, this has been a really incredible
It had.
deep dive
Yeah.
into psychopathy.
Yeah. We've learned a lot.
It's such a nuanced area.
It is.
And it's so much more complex than I think a lot of people realize.
And the media portrays it
Yeah,
often.
exactly.
Yeah.
And I think one of the biggest takeaways for me is that early identification is so important
It is.
and that there is the potential for intervention.
Yes, early intervention is key.
Yeah, and that gives me a lot of hope.
Me too.
And for those of you listening who are interested in exploring this topic further,
Yeah?
the document includes a really thorough list of references,
It does.
highlighting the work of some really key researchers in this field, like Dr. Hare, Dr. Frick, and Dr. Marsh.
Yeah, there's a ton of information out there.
Yeah, so go check those out if you want to learn more.
Absolutely.
So one final thought for our listeners today.
Okay.
Given what we've learned about the complexities of psychopathic traits,
Yeah.